follow-up session. So we'll be recording this session, and this is a very important session for everybody because in this session we are going to have a live testimonial, and as everybody knows that we'll be talking about Dr. Parth Dave, and he'll introduce himself and he will himself talk about what transformation he has seen, almost quite some time back. Okay, and this is also a testimonial by which you will get an idea that this is not just about weight loss, but this is also about sustainability. Okay, and that is what actually is people are looking for, because a lot of us actually, we don't have problems with weight loss, we have problems with sustainability. Okay, and a lot of people are not able to offer this, and from Dr. Parth actually we are going to learn how this guy not only transformed himself, but he is able to maintain it also since quite some time now. All right, so without wasting much time, we'll invite Dr. Parth because he doesn't have too much of time and he has agreed to spend some time with us, 15-20 minutes with us. And we are very much thankful to him that he spared some time from his busy schedule. He runs his own hospital, has a very busy schedule, but we are really thankful that he has come up. Okay, so we'll just Parth, I think your video is probably off. So can you just start your video so that we will take you as a co-host. All right. Okay, fine, good. So great. Just a minute, Parth. You'll be able to unmute. Yes, now you can try. Are you able to unmute, Parth? Not able to? Just a minute. Let me just check the settings. You should be able to unmute. Not able to? All right. Let me just check. Can you check now?
Yes.
Yes, got it. So good. So welcome, Parth, on this session. This is a follow-up session that we conduct for our clients every week on Saturday evening at 9:30 p.m. And we are privileged today that you are there here. And I'll not be talking about Dr. Parth, but he himself will be talking about himself because that's the reason that he's here. And I'm sure you do not want to miss this, although we are recording these sessions. But and I'll be providing this recording with anybody who is wanting to actually watch this, because this can be very inspiring and this will actually reveal a lot of truths, the secrets actually, and I'm sure it will be helpful for everybody. So without wasting much time, let's begin with the testimonial presentation. So good. So Parth, we'll be talking up, I'll be asking you a few questions. Okay, and you can be just to the point. We do not want to take your too much of time also. So the first thing which I want to ask you, Parth, is can you just introduce yourself? What do you do and where are you located?
Yes, I'm Dr. Parth Dave. I'm general surgeon at Halol, nearby Vadodara. Right. And I run my private hospital. That's it. That's what I do for the whole day.
Absolutely. And since how long you are running your hospital now?
Since last 6 years.
Since last 6 years. Wonderful. And I'm sure you must be having a very busy schedule. And I think last time when we had the first time we had a discussion, you had told me that probably you're working almost for 12 hours every day. Is that correct?
Right.
Absolutely. Okay. So that clearly indicates that you definitely have busy schedule like other doctors who are there on this call. Right. Great. So Parth, can you just throw some light on what problems you had earlier? What challenges you are facing with respect to your health?
The biggest problem was my increasing weight. The waistline was ever increasing. The belly was protruding, and my lifestyle was very poor. So it was like I was dying to get help for the same problem.
And since how long you are having these problems actually?
Since I started my private practice.
So almost 6 years.
Almost 6 years, right.
All right. And what was the after effect of these problems? Means, there are a lot of people, who have belly fat, increasing belly size, increasing weight. So what challenges you are facing because of these problems in your day-to-day life?
Actually, the biggest problem was when I applied for my term insurance plan. I got my cholesterol done, and that was very high. That was the first problem that came up to me. Acha, this is what reality is. And the other problems where I realized it after uh, uh, after I joined the program, not before it. That I was taking antacids almost daily. I was overworking almost all of the times. My meal timings were not good. But all these things I realized after I joined your program, not before that.
Correct. Absolutely.
Uh,
And what were
uh,
the means? Can you just tell me some emotional factor, like when you used to look yourself in the mirror, or you had been
uh,
probably thinner earlier, and then you landed up gaining weight. So did
right.
you face any comments from other people or your family members? Can you just throw some light on that?
Oh, yes. Actually, uh, uh, all were of the same thing that, okay, so now uh, you have married and you have joined private practice. So now your weight will always increase. And actually, I used to look quite old as compared to my age. Quite old. Right. So, right. These were the main problems that I was facing. Right.
Absolutely. And did it take a hit on your confidence also?
Yes. Yes.
In,
Absolutely.
so
Absolutely.
in what way
So,
you used to feel less confident? Where do you used to feel it? So can you just put
see,
through some?
prior to increase, when I faced my weight was increasing. Prior to that, I used to wear t-shirts and all. Later on, the belly was always protruding out of it.
Correct.
My shirts and my so it was like typical uncle look that everyone gets when they join their practice, right? So I wanted to reverse it, and right.
So let's talk about
Uh,
that also. I think you had tried
okay.
some things, before getting on boarding the program. So what all
Yes.
things did you try? What results did you get, and why did you stop them?
Right. I tried running. Uh, I tried exercising and all those things I tried, but that was not in a proper way. That was not in a proper guided way. So in a way, I ended up getting injured myself. Yeah, while running, I injured my knee. And right, and rest all. Even when I used to exercise, when I used to do yoga, uh, I used to get injured, I think once in a month. So uh, I used to stop, and I I came back to zero every single time. Uh, I couldn't improve upon my health
Right. And for how many months or years were you trying to lose weight and get in shape before we got into it?
for almost 2 years.
For
For
almost 2 years. All right. Were
right.
you happy with whatever results you got, or did you feel that yes, these are the methods by which I'll be able to achieve the results, and I will also be able to sustain the results?
Uh, See, I got results for a very short duration of time. Maybe I was able to decrease my weight by 1 kg or so, but then I couldn't sustain it. Right, I couldn't sustain it for a longer time, say 1 month, and that's it. I
Correct.
used to.
Why do you think that you were not able to sustain with those methods which you tried?
That was because of proper guidance. I couldn't get a proper guide. How how should I go forward about it? How should I improve my uh, food habits? What should I take? That was the main problem that I realized it afterwards. That this
Absolutely.
was the main. Uh, these were the things that I couldn't that someone couldn't guide me, or I couldn't get the guidance on my own.
Correct. So it's like, what Einstein said, you can't solve a problem with the same mind with which you created it. So, something like that. So good. But
Right,
how did you
absolutely.
got connected to me? I have just forgotten, but can you just throw some light? How did we get
Yeah.
connected?
That we were Facebook friends. So I used to look at your updates. You used to post updates regarding health, healthy life, and so. Out of curiosity, I asked on Facebook Messenger.
Right.
What guidance do you give? Means you are talking of healthy lifestyle and all. So I asked you, that was on birthday, I suppose. That was on my birthday
Correct,
we
correct,
talked.
correct, correct.
Right. And so we decided to get connected on a call, and that's where the journey started.
Absolutely. And see,
Right.
the thing is that yes, we had a conversation, and yes, you were already aware that yes, I work in health and wellness industry, and probably that background was already there. But there are so many people out there who are working in health and wellness industry already. Okay, they who are health coaches, they help people for weight loss, and probably you must have heard about somebody earlier. Why did you decide to connect with me and get started? Why not somebody else?
I'm a surgeon, and I look at it, at your Facebook profile. You yourself are a pediatric surgeon. So I thought you will be able to understand my lifestyle better, rather than someone else who doesn't know what we do whole day, right?
Right,
So
right.
you could understand my physical as well as my mental state better than I suppose everyone out there
Correct.
who are practicing health, right?
Correct, correct, correct. We call it as relatability because I am myself a surgeon, and probably, the doctors, they get connected to me because, they understand that, this guy can probably understand us doctors' issues. A lot of time we have
Right.
certain problems, emergencies and all that. That was one of the reason that, yes, you got connected. Good.
Okay.
So what did you like about the program? We got started, you started working with me, and then what did you like about the program?
See, first of all, I didn't stay hungry. I thought, see, I have to do a weight loss, so I'll have to stay hungry. But not once I felt that I'm hungry for a day. In fact, I thought, oh, I'm getting so frequent meals that I was very comfortable with it. The second thing that improved was absence of injuries uh, while doing exercise.
Correct.
That was probably due to the supplements that were provided. Right.
Right.
Earlier, I didn't know about the protein powders or the multivitamins or vitamin B12 or vitamin D3 that that you focus particularly on it.
Correct.
Probably when these were corrected, I faced, or I shall I say, I didn't face any injuries after that.
Absolutely. I
Right.
think your B12 vitamin D levels were also low when you got started. Is that correct?
Yes, 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 yes,
Right, right. And it
yes,
got corrected within 3 months. Is that correct?
yes. It got corrected within 3 months, right?
Right,
Right.
right, right. Correct. And
Right.
anything else you would like to say about the program, which, was it very difficult to follow, by the way?
No, it was quite not very difficult. It was quite easy, I should say. Uh, Whichever methods I tried earlier,
Hmm.
as compared to that, I thought, okay, bhukha rehna padega, and exercise. There will be lots of exercises and all that, but I didn't face anything.
Right.
I Right. And actually, even in exercise, I remember you told just to you can also start with a walk of half an hour in morning and at night. That is so convenient. That is so
Correct.
convenient for beginners, I suppose.
Correct. Correct.
Right. Right.
Absolutely. And so, Parth, I don't remember, but when did we do the program? How many months back did we do the program?
In 2 years back, 2 years
Two
back.
years. Oh, I was thinking
Right.
1 year back. So this is 2 years back that you had transformed yourself.
Yes.
I was actually thinking
Right.
1 year back, but I know it's almost 2 years,
No,
right?
no.
Time fleets.
Yeah.
So,
Right. Right.
so, so Parth, can you just tell me when you started the program, within how
Right.
much time did you transform your health?
I suppose within 3 months, I got back to my normal weight.
Correct. How
Within
much?
three,
9 kgs total you lost?
yes, 10 kgs I lost.
10
10
kgs
kgs.
you lost. Absolutely.
Right.
And what changes did you see after, you did the weight loss? Apart from the weight loss, what other things has happened? How much inches loss has happened? Kind of energy levels did you see the change? And, can you just elaborate a little bit on that?
Yes, the first of all, I lost 10 kgs. Right. Activity increased quite a lot. I used to feel quite active by correction of my cholesterol levels, my vitamin D, vitamin B12 levels. I suppose I used to feel active a lot the whole
Hmm.
day. Uh, the guilt feeling was gone. That means overeating was gone. Guilt feeling was gone. The antacid tablets were gone. I haven't taken the tablets since last 2 years. I haven't.
Absolutely. And before that,
Uh,
since how many months were you taking that antacids?
uh, Almost every day, I suppose.
So for
Every
how
day.
many years?
Yes, yes, that was since last 10 years. That was uh,
So this even I
so
wasn't knowing that you were taking for 10 years that antacids almost on a daily basis.
right. Even prior to that, my dietary habits were not good. So even then, I used to take antacids, and then later on, because of the stress of practice and all,
Right,
and the meal timings were poor. So
right.
uh, that I realized, even I didn't join, even I didn't expect that my acidity will be corrected by this.
You are not
That was
expecting
late.
that. That was not in the agenda at all.
Yes, I wasn't. And we connected over a call after a few, after I suppose 1 month or so, and you asked, what about your acidity? I told, it's gone. And then I realized, okay, this is the transformation that I'm getting.
Correct.
Yeah,
So within that
right,
month itself, the first month itself, the acidity
right.
problem is completely gone.
Yes, within the first week.
First week itself.
Right,
So currently, so that is 2 years back now, Parth. So
right.
at that time, what was your weight? Means how much you lost 10 kgs and you came down from. Let's have a
Yeah.
look at the testimony itself. I'll share the screen and let's have a
Uh,
look at the testimony itself. So this is Dr. Parth. Okay, so he came down from 75 kgs to 66 kgs. Probably he went to 65 as well. 10 kgs total weight loss. So this is his weight loss. So now currently, Parth, what's your weight right
Yes,
now?
yes.
And can you just throw
Uh,
some light on the current
uh,
situation?
yes, my current weight is 70 kgs, but that is because of my muscle bulking, not because of fats. That is, I
Absolutely
have joined a program for, I'm going to gym and taking protein. So I have
correct.
increased my weight to 70 kgs, but that is because of proteins, not because of fats.
Correct. So you were
Right.
somebody who wanted to build a body like Virat Kohli.
Right. I'm
Correct.
still trying. I'm still focusing on it. I have not lost that goal.
So can you
Uh,
tell me, Parth, now in gym, how you used to work out earlier, how much weights you used to carry, and currently how much weights do you carry now?
no, that's quite a big difference. Quite a big difference.
Hmm.
Uh, with the weights that I carry now, I think the weights have almost doubled up. Weights have almost doubled up, and I haven't seen any injury. That is, I suppose I used to get a knee pain or a back pain or a neck pain. I haven't seen that even after lifting so heavy weight.
Right. And since how long you are consistently doing gym workouts now?
Uh, yes, see, once I lost weight, then I focused on gym training. So that is almost for 1.5 years. I am focusing on gym.
Wonderful. Can you throw some light on what compliments you have received from other people?
Yes, yeah, people do compliment me that they fail to recognize my age. They say you are 28 or 30, and I feel very good about it. That I'm almost now approaching 40, and they people are giving me compliments regarding 28 or 30. So that's what else can you ask for?
Absolutely. So do you believe that reversal of age is possible?
Yes, it is possible.
Absolutely.
Uh,
And that's a lot of hope for a lot of people, who actually have this,
uh,
that probably they are looking a little bit older. Definitely it is possible that you can look younger. Okay. So this can be inspiring a lot for a lot
right,
of people. Can you also
right,
throw some light,
right.
Parth, on what changes other family members have got because you got started with the program?
Oh, yes. See, earlier, all of the family members used to take carbohydrates as main source of energy. And now, diet of all my family members have changed primarily to proteins and good fats, and carbohydrates have taken a backseat. Right, so all of so health of each and everyone has increased. Even my wife has reduced weight just by the advice that Dr. Prashant gave me, and that what was prepared for me at my place.
Correct.
So
I think she lost
everyone in
16 kgs,
the
right?
yeah, she gained very much post pregnancy, and she lost all of her weight uh, just because I joined your program.
Correct, correct, correct. So wife का program free में आ गया.
Right.
So
Right.
one very important thing, Parth, and and this is where a lot of people lack, and they lack in investing in their health. Okay, what do you recommend, Parth? Is it wise to invest in your health in prevention, or is it wise to invest in your health in treatment?
No, it's better to prevent rather than right, rather than to cure the disease.
Absolutely.
Actually, yeah, I reversed my cholesterol only and only with diet and lifestyle modification. Also, my sugar was high. My sugar was around 120, 130. Now it is around 80s. It is in the range of 80 to 100.
Right.
Right. So even then, diet, even people talk about that diabetes is genetic. It's not genetic. It is because of diet and lifestyle. And
Correct.
that I realized after I got connected to you.
Correct.
After I started reading health updates, and then I realized that diabetes is a lifestyle problem, not a genetic problem.
Correct.
Uh, right. So, right. So definitely you should invest in health. That will definitely save you a lot more. I suppose
Absolutely. Absolutely. And can
right.
you put a price tag on what you have achieved, the results which you have achieved? Can you put a price tag on that?
That's priceless.
Absolutely.
That see, come on. When you look at if I get diabetes, if I get a heart attack, and all lifestyle changes, and then I go for angioplasty or take oral hypoglycemic drugs, I wouldn't like that. I wouldn't like that.
Correct.
I would like that my life should be better rather than my life should be long, I suppose.
Absolutely. And basically, even
Right.
after investing that much amount of money, people are still not healthy really. It's like,
Right.
they are
Right.
just
Right.
pulling on. Okay. It's like that.
Right.
So,
That's, I suppose that is a stopgap arrangement that come on, चलो ये नहीं कर सकते तो ये करना
correct.
पड़ेगा. That's it. Right.
Correct. Correct. Wonderful, Parth. Thank you very much.
Right.
One last advice which you would like to give to the people who are on this call.
Yes, I suppose I'm talking all of them are doctors. So please reduce your duty timings. Please improve your meal timing, and I suppose follow a healthy life and a healthy lifestyle. Right, that will definitely help you in better, if, and that will help you save more money rather than uh, working overtime.
Correct. Correct. And
Right.
has this health transformation also helped you to improve your practice?
Uh, it's I suppose I'm more efficient rather than I don't work for longer hours. Now I have reduced my working hours, but I am working in a more efficient way
Efficient.
rather than a. I am right. I'm working more efficiently rather than
Gada
that
Majuri. Rather than Gada
we
Majuri.
yeah right. गधा मजूरी नहीं कर रहे right.
So you are a
Right.
smart, you are
Right.
working smart rather than working hard.
Right. Right.
That's
Absolutely.
great, Parth. It was absolute pleasure talking to you. Thank you very much for
Okay.
taking out your time and,
Okay.
spending valuable about, 15-20 minutes with us. Really
Okay.
appreciate it. Thank you very much.
Okay. Okay. Thank you. Thank you very
You
much.
can log off, Parth, if you want at
Okay.
this point of time.
Okay.
Thank you. Thank you.